Hello there, I'm Monica Reinagel, and you're listening to the Nutrition Diva podcast, a show where I take a closer look at nutrition trends and headlines, explain what the latest research means for you, and answer your nutrition questions. Today, we're going to talk about how to lower high triglyceride levels. But first, a quick listener Q&A. Ken writes, strolling through the farmer's market last weekend, we came across a merchant selling blue-shelled eggs, and they claimed that their eggs were lower in cholesterol than typical tan or white-shelled eggs. Is there any evidence supporting this claim? The cholesterol content of eggs does vary somewhat according to the breed of the chicken, but also its age and the type of feed and housing conditions. And there is a rumor that the lovely pale blue and green eggs produced by a South American breed of chicken called the Araucana are lower in cholesterol and higher in protein than other eggs. This rumor actually dates all the way back to the 1970s, when it was widespread enough to prompt poultry researchers at the University of Connecticut to run some studies comparing the nutritional content of Araucana eggs to the white and brown eggs most commonly found in U.S. markets. Drum roll, please. The Araucana eggs were in fact found to be modestly higher in cholesterol and actually lower in protein on average than the other eggs. And this was due mostly to the fact that Araucana eggs tend to have bigger yolks and less egg white. But really, who cares? For one thing, while the differences were statistically significant and certainly debunked the claim, they weren't big enough to have a really meaningful impact on people's cholesterol or protein intakes. But more importantly, for most people, the amount of dietary cholesterol consumed has very little effect on the amount of cholesterol in their blood. And that actually gives us a perfect segue into today's main topic, which is how to lower high triglyceride levels. So first, let me just clarify the difference between cholesterol and triglycerides. Both of these are types of fats that circulate in your blood, but they have different functions and different health implications. Your body uses cholesterol to build cells and to make various hormones. It travels around in your bloodstream in little packages called lipoproteins. LDL and HDL, the two types of cholesterol that we talk about most often, stand for low-density lipoprotein and high-density lipoprotein. Cholesterol is a nutrient that's found in animal-based foods, especially egg yolks, certain types of shellfish like shrimp, and organ meats like liver and kidney. But as I mentioned earlier, dietary cholesterol has relatively little impact on blood cholesterol. Most of the cholesterol circulating in your blood is not from your diet, but it's manufactured by your own liver. Triglycerides, on the other hand, are a type of fat that your body uses for energy. So if you take in more energy or calories than your body needs, the excess will be stored in your fat cells in the form of triglycerides. And these triglycerides can then be used for energy as needed. So anything below 150 milligrams per deciliter is considered normal or healthy. Although the American Heart Association recommends that we aim for triglyceride levels below 100. A triglyceride level between 150 and 200 is considered borderline, and above 200 is considered high. High triglycerides can increase your risk for heart disease, stroke, and other health problems. In fact, high triglycerides are more strongly associated with heart disease risk than high cholesterol levels. A standard blood test known as a lipid panel is going to measure cholesterol and triglyceride levels. And if you're over 50, your doctor will probably be ordering that test on a regular basis just to keep an eye on things. Both cholesterol and triglyceride levels can be affected by your diet and your lifestyle. And lifestyle modification is always the first step before pharmaceutical interventions. So let's start with the non-diet related factors. If you are carrying some extra body weight, losing just 5 to 10% of your body weight can help lower your triglyceride levels. Regular exercise, such as brisk walking or cycling, can also help, and you want to aim for at least 30 minutes on most days of the week. As for dietary adjustments, a diet that's high in saturated fat can increase both LDL cholesterol levels and triglyceride levels, and conversely, reducing saturated fat can bring them down. And saturated fats are found in butter, cheese, processed meats, coconut, and palm oil. Sweets, including sugar-sweetened beverages, as well as refined carbohydrates, things made with white flour, can also increase your triglyceride levels. So if these are a big part of your diet, you might want to reel that in a little bit. Drinking too much alcohol can also increase triglyceride levels. So if you're consuming more than 7 to 10 standard units of alcohol a week, cutting back on that can help. But I always think it's more fun to concentrate on the things that you want to eat more of than the things that you need to reduce. And so to that end, eating more fruits, vegetables, legumes, and whole grains can have beneficial effects on both cholesterol and triglyceride levels, and that's mostly due to their fiber content. In addition, omega-3 fatty acids found in fatty fish, walnuts, and flaxseed can also help lower triglycerides. Monounsaturated fats, which you're going to get from olive oil, avocado, and almonds, can also be beneficial. And finally, fish oil supplements have been shown to lower triglycerides in some studies. However, the dosages used for lowering triglycerides are pretty high, often 5,000 milligrams per day or more. And taking that much fish oil could potentially interfere with other medications or have a blood thinning effect. So it's important to talk to your doctor about whether that makes sense for your situation. We always want to do what we can with diet and lifestyle before we resort to medications to control risk factors like this. But sometimes you can be doing everything right and it's still not quite enough. High cholesterol or high triglyceride levels can be an inherited predisposition. They also tend to go up with age. Fortunately, though, when all else fails, there are prescription medications that can help lower stubbornly high triglyceride levels. And these are different than the medications that are used to lower cholesterol. And if this turns out to be necessary, this doesn't mean that you have failed. So please don't beat yourself up. But for those who do need a little pharmacological support to control high triglycerides, it's still worth following all that lifestyle advice I just gave you, because that's going to make the medication more effective and reduce the amount that you're going to need. In case you're wondering, it is possible for triglyceride levels to be too low, although it's pretty uncommon. Diets that don't contain enough fat, for example, can cause triglyceride levels to dip dangerously low. So just one more reason to avoid extremely low-fat diets. And there are also some medical problems that can cause abnormally low triglycerides, such as an inability to absorb fats or hyperthyroidism. But as I said, this is a pretty uncommon situation. This is Monica Reinagel, the Nutrition Diva, and if you have a question you'd like me to answer, you can email me at nutrition@quickanddirtytips.com. You can also leave me a voicemail at 443-961-6206. Nutrition Diva is a Quick and Dirty Tips podcast, and I'm supported by a fantastic team, which includes the director of podcasts, Adam Cecil, my audio engineer, Nathan Sems, Davina Tomlin, who runs our marketing and publicity, Holly Hutchings, who is our digital operations specialist, and Morgan Christensen, who is our podcast operations and advertising specialist. And last but certainly not least, Cameron Lacey, our intern. Thanks so much for listening. I'll be back next week with another episode.